All right, that was President Cyril Ramaphosa a little bit earlier on this evening talking about how the churches are going to be able under level 3 to start opening up under very restricted formats to be able to start the work that they do. And one of the key things will be that the gatherings will be limited to 50 people and social distancing must be adhered to and masks must be worn. Well, to hear a little bit more on what these announcements boil down to, we've asked Doctor Kgosi Letlape to join us. He's a healthcare leader and commentator. He's joining us via Skype now. Thanks so much indeed. Always a pleasure to talk to you. The President, I guess this was probably one of the things that he's been under pressure to consider because we live in a country where our faiths are important to us. Your take on what that might mean in terms of for the next part of our COVID-19 journey?
Good evening, Peter, and good evening to the viewers. I think it is something that millions will welcome in South Africa, but it comes with great responsibilities for the religious leaders. If you remember, more than 60% of the cases in Korea arose from a church. If you remember, in South Africa, in Mangaung, a religious retreat accounted for a major contribution of the numbers in the Free State. So this comes with immense responsibility for the church leaders, because those confined spaces can actually be a great medium for transmission. So they need to be extra careful in terms of being diligent about the safety measures, particularly the masks, the distancing, and the no physical contact. Now, what makes it particularly difficult for churches is the singing and the airflow in those confined spaces. Because as we sing, we produce a lot of aerosol. So if there's one person that might be an asymptomatic carrier of COVID, with the singing, they have to be particularly careful.
All right, so the masks, I guess, is going to be one of the things that's very important, and also the social distancing. They can't sit next to each other as they've done in the past, and that might be the difference between what we saw in Bloemfontein and South Korea.
Yes, and I think they should not be deceived by the number 50. 50 is the maximum if you have a huge auditorium or cathedral space. If you have a smaller space, you got to keep 1.5 meters between parishioners and divide your space for the maximum number that can come in. And for some of the churches, it will be far less than 50 to keep to the safety distances and safety measures that are being advocated. The other issue is the cleaning of surfaces, as the President has alluded to. That should be done thoroughly between services, and it might be appropriate to limit the number of services that you have on any one day, because you require that church to be scrubbed down properly, or that place of worship to be thoroughly clean before the next session of worship.
All right, you know, some people might say, but, you know, we've been doing funerals with 50 people already. How different will this be then?
Well, this is different in that, depending on the funeral, a lot of that activity occurs in open air, outside, in the cemeteries. The management would still be the same. But if you go to a graveyard, you have far more space to observe the physical distancing for the maximum 50 that attend. When you come into a sanctuary, the space of the sanctuary becomes the major limiting factor. But also the norms where people hug each other, they shake hands, they need to ensure that those things are not done. I would also recommend our irresponsible habit of the elbow shake, which compromises the physical distancing, to be done away with. Let's bow to each other. Let's respect one another. but let's keep the physical distance and the social solidarity.
And I would imagine, I mean, some of the practices such as drinking of wine from the same cup, that's really got to go, hasn't it?
Well, if you look at what has happened in other countries, the Catholic churches in other countries have taken away the water bowls and the fountains that sit at the back of the church. They've done away with those things that are shared so that they can reduce contamination. The sacrament of Holy Communion, they have to be particularly careful about those issues. The physical distancing in a mosque where people are on the floor and they pray, they need to ensure that they observe the physical distancing. And all other places of religion, the shuls, etc. The cleaning of surfaces, the physical distancing, the cough etiquette, face masks, those are critical measures that need to be taken. And all the clergy have to ensure that they modify their usual rituals to ensure that they minimize any chances of transmission of the virus. Remember that the fact it's not people that are sick. We have 30% of people that carry COVID-19 are asymptomatic. So for us to be safe and to curb the infection, we got to treat each other as I am infected. And the key issue, we always talk about PPE, which is personal protection equipment. That is for the health setting. What we now need to be doing is Pope B, I call it, protection of others, protective equipment, and appropriate behaviors. That's what all of us need to embark upon to ensure that we curb the spread of the virus.
And I would imagine they're talking about staggering services to try and get as many in as possible, but they would probably also need quite a break in between so that the last crowd actually disappear from the car park, leave the premises before the next service starts.
Yeah, unless you have a professional crew that comes in to do the cleaning between services, it would be very difficult to restore the sanctuary to the previous state before the first users. So I would hope that to start, they would either space, maybe have a morning service and an evening service, and you have 8-10 hours in between to restore the sanctuary to its sanctity. Besides that, you will be compromising the safety of the parishioners.
So, I mean, it's a concern to a lot of people. If you look at social media, it's the #1 trend, for example, which means a lot of people are scared and fearful that this actually is going to escalate the problem. If we do the right things, do we need to be fearful?
I'm not advocating fear. We just need to be extremely careful on these issues. And I hope some of the religious bodies that have sacraments like Holy Communion would consider to create drive-in systems where the pastor could wait in the driveway and people can drive past. You've seen drive-in testing as you are displaying right now. I hope the religious leaders will be creative in terms of how they can modify their normal procedures to ensure that they maximize the safety of the parishioners.
There is also a danger, I suppose, that some churches may be prone to certain practices that we don't always see. I mean, we've had churches where people have eaten grass and all sorts of things like this. Is there a fear that, perhaps some might be defiant in the ways that they do their things, and in the name of their church, in the name of their God, that they think that there will be healing in these spaces and expose themselves to danger?
I hope all religious leaders would understand the importance of physical distancing and all those rituals that entail physical contact. I hope they'll be deferred until we are out of this pandemic, or maybe we are in level 1 or level 0. The issue is this, that people need to understand that these are not normal times. So they cannot go back to normal behavior. The graciousness of the president in allowing religious activities to resume should not be seen as a license for normal activities to resume.
So how do we explain to people you can go to church with 49 other people, but you can't go visit your mother?
I think we are not saying to people you can go to church. We're saying the places of worship are open. People have been worshiping without going to church. And one of the areas that concerns me is that at least where I used to go to worship, the average age is quite high. It's above 60. The majority of the parishioners are the vulnerable age group. So I hope there would be serious consideration by the religious leaders in terms of allowing the young ones to come and the old ones, if they have an ability to connect electronically, to continue to connect electronically to the service and to the sanctuary. Those are the issues that need to be considered. Because given the average age of at least where I go to church, these are highly vulnerable populations. Or we are extremely vulnerable. Let me not speak in the third tense, because I'm part of those that are over 60 that may have comorbidities.
All right, Dr. Letlape, thank you so much indeed. It's always a pleasure to talk to you. Thank you for your insights this evening.
And I think they must remember hand washing is a cornerstone to the behaviors that we promote. They must ensure that they provide sanitizers. They must ensure that they provide soap and running water in the ablution facilities so that the parishioners have an opportunity to sanitize or wash their hands before they come into the sanctuary and when they leave the sanctuary.
All right, thank you so much indeed. That's Dr. Kgosi Letlape, who's a healthcare leader and commentator, sharing with us his thoughts after the announcement earlier this evening by the President that places of worship have been opened as of lockdown 3, which begins on the 1st of June. And that the maximum number of people in these places of worship at any given moment in time will be 50. Social distancing must be applied and masks must be worn by all the people in attendance.